Besides our focus on splicing factor mutation dependent splicing defect, we also discovered that CLL in general has splicing defect, which is irrespective of splicing factor mutations. Through an integrated RNA sequencing as well as proteomic data analysis, we are able to discover that really looks like our splicing pathway is post-transcriptional regulated, which we are able to further validate it in independent cohort of proteomic data as well as RNA sequencing data. So upon further inquiry on the clinical association among the splicing factor upregulation, we discovered that the abundance of major spliceosome is a predictor of CLL poor prognosis, which is independent of IgHV mutation status as well as 17p deletion status. So we then try to query about the potential upstream regulator of this splicing factor upregulation. So through the correlated protein expression analysis using our proteomic data, we discovered METTL3, which is RNA methyltransferase, is playing a very critical role in driving the upregulation of splicing factors. So importantly, METTL3 by itself is associated with shorter time to first treatment, very upregulated in CLL, and the knockout of this gene leads to cell growth arrest in both in vivo and in vitro. So from the molecular characterization, we are able to discover that METTL3 can control the translational machinery through an M6A dependent manner, for which the whole story together that METTL3 upregulation in CLL can promote splicing factor upregulation, leads to splicing dysregulation, and then contribute to the aggressiveness of CLL. I think I want to focus on METTL3 part. So as I just mentioned that METTL3 is significantly upregulated in CLL and is regulate a network of RNA splicing protein expression. And with METTL3 inhibitor currently is in the clinical trial, I would predict that be able to identify the upregulated METTL3 status in the aggressive type of patient. So METTL3 can be potentially a good inhibitor that potentially we can use to treat the CLL patient.